I want people to get a visual. Is Nasser Hospital look like, a Kaiser Permanente? Like, is it like a real structure? It's
Yeah.
big, it's massive, and it has not been, I guess, damaged because I think it's the only hospital left, if I'm not mistaken. 35 out of 36 hospitals
Yeah.
have been blown up.
Yeah. There's a small hospital in near Gaza City that is um, still having limited resources. I mean, extremely limited resources. Not a functioning hospital at all. But yeah, so that's a great point, Ray. Nasser Hospital is about a 500 bed hospital. In your average city of say 250,000 people in the United States, like a decent sized city,
Yeah.
you'll probably have one or two 100 to 200 bed hospitals. So it's a pretty big hospital.
Okay.
It's the
Okay.
equivalent of a smaller academic, U.S. hospital. But, and it's interesting though, because they normally have a robust number of services, but because of the genocide and all the destruction of the 35 other hospitals, all of the specialists who haven't been killed have migrated to Nasser. So you have all of these, Palestinian specialists there who are able to really dive in and, and get her done.
Got it.
It
Yeah,
is
yeah.
just it is shocking how well that hospital is working, and that really goes, it speaks so much to the people there, the nurses.
Is the internal clean? Like I always worry about, I mean, hell, sepsis kills like
Yeah.
200,000 Americans in US hospitals. So like when I think of like sepsis in the Nasser hospital, is it clean? I mean, what is it
Yeah, yeah.
like?
So I mean, it's constantly being cleaned, and they're using, especially in surgery, they're using really good aseptic technique.
Okay,
But
amazing.
and then the trauma resuscitation area, it was just so overwhelmed that we definitely cut corners. Unfortunately, sometimes we were always trying to do as good a job as we could. But for example, I had a situation where I had a 12-year-old boy that was shot in the head, and he had what we call brains out. So he had gray matter, brain tissue in his hair, but he was still breathing. He still had good vital signs. It was an isolated injury, nothing else. He was laying in a pool of blood, literally a quarter of an inch deep. And I was kneeling in that same blood pool. And I was trying to intubate him, which is to put a breathing tube down into his
Yeah.
lungs to breathe for him. We were eventually going to try to elevate his head and hyperventilate him for a little while, like breathe quickly for him so that we could blow off extra CO2, which would decrease his intracranial pressure and make it so that he have a better chance of survival. And I couldn't quite get my body in a position to intubate him. So I said to somebody, "Hey, can we please pull him out into the room a little bit?" When somebody grabbed his feet and pulled him, the dressing on his head came off, and we pulled his brain tissue in his skull through the blood of 5 other people.
My God.
So, once I got him intubated, I turned him on his side. I took antiseptic and soap and large amounts of water, and I just sat there and tried to clean the back of his head as well as I could. We started him on antibiotics. I have a feeling there was a unlikely that he was going to survive anyway. I would say that in general, they followed really phenomenal aseptic technique, very clean, people constantly cleaning. Every 20 minutes, a crew of people would come into the resuscitation room and squeegee the floors clean. They would be just completely covered in blood and then down the drain, 20 minutes later. But yeah, so it's a highly functioning, pretty big hospital. It's very impressive. But
Okay,
what
okay.
makes it
But
really
but
an
obviously what you're describing, I mean, it's hard to even understand how just insane that must look while you're in it. Like, I can't even imagine trying to perform something medical on a child, let alone something involving, a brains out situation like you described, being in a pool of, quarter-inch blood. Like,
yeah.
that's insane. That
It
is
is. And
insane.
the other part of it was that, there would be 30 or 40 patients there. Sometimes they'd be stacked up on top of each other waiting for us to get to them, you know? And yeah, it was overwhelming. I think if you people have seen the TV show The Pit,
Yeah.
And it's the last like 3 episodes is a mass casualty event it's pretty intense. It's very chilling, and it seems very much overwhelming. And they saw 112 people in that, you know, in that narrative.
In that
You know,
narrative, yeah.
on June 17th, 2025 at Nasser, we experienced what we think may be the single largest mass casualty event in a civilian hospital in modern history that we can think of. We saw over 400 trauma patients.
That's insane.
250 of them were unstable multi-system trauma patients requiring aggressive resuscitation, multiple procedures, life-saving procedures, and going to surgery. 95 people died on the table or on the floor while we were working on them. And then the rest had serious, serious injuries. And so, you look at this TV show, the Pit, which is a pretty good show. And in that mass casualty, they saw 112. We saw between 4 and 450 people that day. So 4 times that number.
That is amazing. What time did your day start? Are you like 6 a.m.
Yeah.
to
Yeah.
what's
Well,
the
it's really
shifts?
funny because the work is so uh, absurd
Yeah.
that there really was no schedule for the international doctors. So when we got there, uh, I was with another U.S. emergency physician from Houston, and we thought to ourselves, we're going to work, 10, 12-hour days, take a break and come back. And the other emergency physicians from Gaza were like, well, I think you should try 4 hours. Just do 4 hours. And we're like,
4.
4 hours?
Yeah.
And, after 4 hours, I found myself staggering away, literally just staggering away from the emergency department, just going, like, holy moly, what is going on here? And so yeah, I mean, like, I was there for,
And that's because it's just patient after
yeah,
patient after
yeah,
patient after patient. And by the way, are these wounds predominantly like gunshot wounds? Like, are people getting I honestly, from what I see, they're
yeah,
almost getting snipered off,
yeah.
you know what I mean? It's not like random gunshot wounds like in the abdomen or in the leg. It seems like sniper gunshot wounds to where they're being picked off like this, right?
Absolutely. So there's been an evolution in the injury pattern. So early on in the genocide, when there were still a lot of structures, when these structures were being demolished with bombs, people were getting a lot of crush injuries. So there are a lot of people who are just, crushed.
Crushed.
And there's like a whole sort of different pathophysiology of crush injuries and how to take care of them, what to predict, etc. But then, there are no superstructures anymore. They're just exposed people. And, so if they're hit by tanks, which we saw, which would happen some days, these tank shells would just rip through everything. So you have combined head, neck, chest, abdomen, limbs, just completely shredded, like they were thrown through, a meat shredder. And those patients are so challenging to take care of. I mean, they're the lethality of those, even if they seem initially relatively stable, the chance for infection and
Yeah.
long-term disability and everything is so high. But when most of the time that I was there, so I got there June 12th, which was very shortly after the GHF started their so-called food distributions.
Yeah.
And that's when we started to really see these predictable sniper types of attacks. And I'm not a weapons expert, and I'm not an expert in sort of war injury. And now those experts are coming out and they're looking at the data and they're saying absolutely this was intentional sniper. And even IDF soldiers and other people responsible for this have started to leak information that that's precisely what they were doing. So one day we would see all head injuries. So in the front of the head, the side of the head, a large caliber projectile wreaking just catastrophic injury to the brain and the skull. Some people were probably lucky enough to survive, but probably with great disability. Many were dead upon arrival. But then the next day we would see neck wounds. And so we'd see all these crazy neck wounds where it would often either make them quadriplegic, paralyzed for the rest of their life, maybe even to the point where they stop breathing on their own. Other times they just wreck the trachea. So air would escape underneath the tissue. We call it crepitance. And so you have like this, all these, it's like Rice Krispies in the chest and neck. And those patients needed to be intubated and needed to have a breathing tube down their lungs for a long period of time before they can get a repair. And those patients are also really at high risk because long-term intubation under these circumstances puts them at really high risk for what we call ventilator assisted pneumonia and, fungal infections and
Yeah.
complex infections. And then the next day, then we'd see all chest injuries. And then we would see all groin injuries. And the groin injuries are like among the worst. You think the groin, well, you've got major blood vessels that are
Yeah.
there that are very difficult to compress, to put direct pressure on to, stave the bleeding. And also they often will come with rectal and gut injuries. So not only do you have all this vascular trauma, but you got feces,
Yeah.
mixed in among it all, and it's just so devastating to look at a 10-year-old boy who has this and he's awake and thinking and talking and you're looking at him in the face and you're just, trying to not sort of convey by the way that you look, to
Yeah.
them that
Yeah.
your life is over, kid, and it's devastating, and it's funny because a lot of people say that it's hard to put words to describe what's going on. And it's really not that hard to put words to it. It's just that the words are so foul and
Yeah.
grotesque
Yeah.
and
Yeah. Yeah.
abnormal and, gut wrenching that it's hard to put words to it, but
No, I
yeah,
get it, man. I get it.
yeah,
It's hard to even visualize. Like again, I mean, I'm trying to visualize everything as you're talking about it, and I really want the audience to visualize just how insane what you're saying you saw day after day after day, hour after hour after hour. I mean, have you ever seen anything like this in your career in the United States? Like even one
no.
time?
No, I mean, occasionally when I've worked at major trauma centers, I've seen, you know, um,
Want the full truth? Watch the full Deep Shallow Dive interview next. And hit subscribe if you're done with narratives and ready to call a spade a spade.